Hey there everyone, welcome back to our channel. Do you ever wonder if your struggles with depression are really a disease or just a state of mind? It's a question that many people struggle with, especially those who suffer from this condition. Psychologists and psychiatrists have been debating this for years. The truth is, there may not be a simple answer. Depression can be both a disease and a state of mind. How confusing is that? In this video, we'll take a closer look at both sides of the argument to help you better understand what depression really is and how to deal with it effectively. So let's get started. No. 1. The disease viewpoint. First, let's examine the idea that depression is a disease. Proponents of this viewpoint argue that depression is a real medical illness with biological underpinnings. They point to studies showing that depression is associated with changes in brain activity and structure, as well as imbalances in neurotransmitters like serotonin and dopamine. This perspective also considers how depression can affect a person's daily functioning, making it difficult to work, study, or maintain relationships. It can also lead to neglecting basic needs like hygiene or skipping meals, which can further worsen one's physical health. Furthermore, depression can be cyclical and chronic, lasting for months or even years, with varying degrees of severity. People who suffer from depression may experience recurrent episodes throughout their lives, and each episode can be unique and present with different symptoms. This perspective also acknowledges that depression is highly heritable, and that genetic factors play a significant role in its development. If depression is a disease, then those who suffer from it are not to blame for their condition, and they should not feel ashamed or stigmatized for seeking help. Instead, they should be treated with compassion and understanding. Treatment options include psychotherapy and medication, which can be highly effective when used appropriately. But if depression is a disease, why does it feel like a state of mind? And what is the difference between the two? Let's find out in the next part of the video. Number 2. The state of mind viewpoint. On the other hand, some believe that depression is more of a state of mind, a product of one's mindset and environment. They argue that while there may be biological factors contributing to depression, a person's thoughts, feelings, and behaviors also play a significant role in its development and maintenance. This perspective emphasizes the importance of considering a person's life circumstances and how they may contribute to their depression. For example, a person who has experienced a major loss or who is going through a difficult period in their life may be more susceptible to developing depressive symptoms. Moreover, this viewpoint recognizes the role of learned helplessness in depression. A person who has experienced a history of trauma or abuse may develop a learned helplessness that makes it difficult for them to assert themselves or seek help. This can lead to a sense of hopelessness and despair, which are hallmark symptoms of depression. Additionally, this perspective highlights the impact of negative thinking patterns on depression. A person who has a tendency to think negatively or to make assumptions about the future may be more likely to experience depressive symptoms. For example, a person who always expects the worst or who assumes that things will not work out may be more vulnerable to depression. Finally, this viewpoint recognizes the role of interpersonal relationships in depression. A person who has a history of social rejection or who has difficulty forming close relationships may be more susceptible to depression. Social isolation is a risk factor for depression, and a lack of social support can make it difficult for a person to cope with stress and adversity. No. 3. Finding the middle ground. So where does the truth lie? Is depression a disease or a state of mind? The answer may actually be that it's both. Depression can be seen as a disease because it has biological underpinnings and can be effectively treated with medication and therapy. At the same time, it can also be seen as a state of mind because a person's thoughts, feelings, and behaviors play a significant role in its development and maintenance. This perspective is known as the biopsychosocial model, which recognizes the complex interplay of biological, psychological, and social factors in depression. Taking this approach allows for a more comprehensive understanding of depression and can lead to more effective treatment plans that address all aspects of the illness. Ultimately, the most important thing is to remember that no matter what the cause of depression may be, it is a serious condition that requires professional help. If you or someone you know is struggling with depression, please reach out to a qualified mental health provider. They can help you understand the underlying causes of your depression and develop a treatment plan that addresses your specific needs. Remember, there is no shame in seeking help, and treatment can be highly effective in managing depression. Number 4, recognizing the warning signs. It's important to be aware of the warning signs of depression so that you can seek help if you or someone you know is struggling. Some common warning signs include changes in sleep or appetite, difficulty concentrating, feelings of worthlessness or guilt, social withdrawal, and lack of interest in activities that were once enjoyable. If you notice these warning signs in yourself or someone you care about, don't hesitate to reach out for help. Early intervention and treatment can make a big difference in managing depression. No. 5. The role of mindfulness and self-help practices. While it's important to seek professional help when needed, there are also things that you can do on your own to help manage depression. One approach is mindfulness, which involves paying attention to the present moment without judgment. Mindfulness can help you become more aware of your thoughts and feelings without getting carried away by them. Another approach is self-help, which involves taking proactive steps to improve your mental health. This can include setting small, achievable goals, practicing self-compassion, and engaging in activities that bring you joy. While these practices are not a substitute for professional help, they can be helpful in managing depression and improving your overall well-being. In conclusion, the nature of depression is a complex and highly debated topic. While there is no simple answer to whether depression is a disease or a state of mind, it's important to remember that it's a serious condition that requires professional help. By understanding the different perspectives on depression and recognizing the warning signs, you can better understand this illness and how to manage it effectively. Whether you see depression as a disease, a state of mind, or a combination of both, the most important thing is to seek help if you or someone you know is struggling. With the right support and treatment, it's possible to overcome depression and live a fulfilling life. If you found this video helpful, please leave a thumbs up and share it with others who may benefit. Don't forget to subscribe to our channel for more informative content. Thank you for watching, and we'll see you in the next video. Have you found this video interesting and informative? Tell us in the comments below what you think depression is and why. Share your experiences and insights with others. We value your input and encourage you to join the conversation. Don't forget to like this video and share it with anyone who might find it valuable. Subscribe to our channel for more informative and helpful content. Your support helps us continue creating valuable content. Thanks for watching, and we'll see you in the next video.